subscribing, and like, comment, and share. Yeah, I really need you guys to support this work so that I can be encouraged to continue. And as most of you know, I'm doing this because of passion, pure passion. There's nothing else but just passion. So yes, so yesterday we did discuss adult hyperbilirubinemia, and I want us to continue with neonatal hyperbilirubinemia. So far we know how bilirubin is produced, red cell breakdown and that kind of stuff. So we're doing neonatal hyperbilirubinemia. So as we all know, you know that a neonate, I don't want to say a baby, but I'll say it, a baby of less than 28 days and now we know what hyper is, which is high, and then bili is bilirubin, and emia is blood. So, and we did say that once someone has hyperbilirubinemia, they will present with jaundice. And we did say that jaundice is the yellowing of the sclera of the mucosa of the skin. What else? Yeah, etc. So that's jaundice. And that jaundice, remember, bilirubin is a pigment. It is accumulation, excessive amounts of bilirubin that causes the yellowing, which is jaundice. But now here we are talking about neonates. So we've got this neonate less than 28 days old and is coming in presenting with jaundice, and because they've got jaundice, we already know that okay, they have hyperbilirubinemia. But what is happening? Let's classify hyperbilirubinemia. Neonatal hyperbilirubinemia is okay, let's do the same thing that we did for adults. When you've got someone who's got jaundice, a baby who's got jaundice, you say to yourself, okay, they've got yellowing of all those things, they must be having hyperbilirubinemia. Hyperbilirubinemia. Otherwise, they wouldn't just turn yellow for no reason. Now, obviously, you are going to take the history from the mother, examine the baby, But now I want to get straight into the bloods now. So in this case, you decide, okay, I'm going to do bloods. Yes, you're going to do the FBC, the UNE, the LFT, the infective markers, that kind of stuff. But here I want to talk about purely TSB and conjugated bilirubin and unconjugated. So like we said yesterday, once you've got this kind of patients, you do a total serum bilirubin. When the total serum bilirubin is out, okay, the bloods that you take, TSB, yeah, you're gonna take the other bloods, like I said, depending what you're trying to investigate, but this needs to be there. These bloods needs to be there. So you're gonna do the TSB and do the conjugated fraction and the unconjugated fraction. So the TSB will be high. It's gonna confirm your hyperbilirubinemia. Now look at the fraction of the unconjugated bilirubin. Unconjugated. If when you look at the two fractions, meaning the conjugated and the unconjugated bilirubin, if the unconjugated is very high compared to the conjugated, then it means you've got unconjugated hyperbilirubinemia. We said this for adults as well. Hyperbilirubinemia, right? In other cases, you can have a situation whereby you've got hyperbilirubinemia, but the conjugated bilirubin is much more higher than the unconjugated. So in that case, you've got conjugated hyperbilirubinemia. Right? So when it comes to neonate, this is a guy that you want and this is the guy that you don't want. When you've got, okay, I'm saying when it comes to neonates, this is the guy that you want. It's the same guy that you want, and it's the same guy that you also don't want. You want this, but you also don't want this. This one is a no-no. Why am I saying that? Why am I saying you want this? If you have got, I'm talking about neonates, guys. If you have got hyperbilirubinemia, and then you find that your hyperbilirubinemia is conjugated hyperbilirubinemia, that points to problems for the neonates. Remember, that's surgical jaundice. So it means this kid needs to some kind of operation because there's an obstruction. You don't want this kind of hyperbilirubinemia for the neonate. Things like your biliary atresia, anything that can obstruct the conjugated bilirubin. So this is surgical jaundice, and when you have it in the neonate, it means that there's some kind of anatomical abnormality in the baby. And when you have got that, you might be having some kind of a syndrome. I mean, there's a lot that can go wrong. If the biliary tree does not form nicely, it could be that there are other organs that have not formed nicely. So you don't want that. And once you've got a neonate who's got hyperbilirubinemia, and when you look at the fraction, you've got conjugated hyperbilirubinemia, do not keep that patient. Send that patient to a neonatologist and possibly surgical intervention will be done. So that's a no-no. This side, why am I saying this is the guy that you want? This guy is the guy that you want because it's easier in most cases to deal with unconjugated bilirubinemia than conjugated, like I said. There are a lot of causes of unconjugated hyperbilirubinemia in the neonates that are benign, that are not problematic. There are so many of them. So this one gives us hope that, oh, okay, at least we might be having unconjugated hyperbilirubinemia, but not all is lost. It could be that we still have some benign conditions that are causing the unconjugated hyperbilirubinemia. But this side, once it's conjugated, that's problems. Okay, that's the first point. Why this is the first point that what I'm trying to drive into you guys is that when you've got hyperbilirubinemia, you rather have unconjugated hyperbilirubinemia. The second reason, okay, the second point, I said this is the guy that you want, this is the guy that you also don't want. And I've explained why you would rather have this than have that. Now, the second point is, why is this guy a guy that you don't want? The problem is that unconjugated hyperbilirubinemia, like we said, it's lipophilic. It's lipid soluble. The reason why I explained this the other days, because I wanted you guys to grasp this, because this is very, very, very important. And the reason why, the reason why we don't want this guy is because unconjugated hyperbilirubinemia is lipophilic and is lipid soluble, which means it does cross the blood-brain barrier. And if it crosses the blood-brain barrier, it causes what is called bind. When unconjugated hyperbilirubinemia, or that molecule crosses the blood-brain barrier because it's lipophilic, because it's lipid soluble, it crosses the blood-brain barrier and causes what they call bind, which is bilirubin induced neurologic dysfunction. This bind occurs because unconjugated bilirubin is able to cross the blood-brain barrier because it's able to get through the bilipid layer, gets to the brain cells and starts damaging them, and then the child gets that. Bind has got two types. It has got the chronic and the acute. Acute bilirubin encephalopathy and chronic bilirubin encephalopathy. Acute bilirubin encephalopathy and chronic bilirubin encephalopathy. Chronic bilirubin encephalopathy, they used to call it kernicterus. So, conjugated bilirubin is is lipophobic. Is lipophobic and is water soluble, so it doesn't cross the blood-brain barrier, so it doesn't get a chance to damage the brain cells. But this guy is able to do that, to cross and cause that damage. So that's why I said this guy is the guy that you want, is the guy that you don't want. I explained the first reason. If you've got unconjugated hyperbilirubinemia, you can keep that patient and be like, okay, let's we hope that this baby is having one of those benign, which we're going to talk about, the benign causes of unconjugated hyperbilirubinemia. But so that's the first reason why I said it's a guy that you want. Unlike that one always points to problems when you've got conjugated. And then the second thing is, you don't want this guy because of the bind. This one doesn't cause the bind, but when you have this guy, it always points to surgery in most of the cases, right? Like I said earlier, that when you've got like things like biliary atresia, those normally do not go alone. There might be other anatomical abnormalities in the baby, right? Okay, so guys, I'm gonna clear space now and let's talk about unconjugated hyperbilirubinemia in the neonates. This is what you would prefer anytime